The FDA has approved a new medication to treat an awful disease. The treatment targets ALS, unlike any other medications. Royce Jones is here with more on the medication and the impact doctors are hoping this has. Royce.
Yeah, Ken, so it's still being studied, but doctors who specialize in the disease are really enthusiastic because it sets the groundwork for development of future ALS medications, possibly expanding the availability of treatment. According to Dr. Sandeep Raina from Allegheny Health Network, at least 30,000 people are dealing with ALS in the United States and an estimated 300 to 500 in the Pittsburgh area.
ALS is a devastating illness. It's a neurological disease where patients start to get weak. They lose muscle strength, they lose muscle mass.
It can impact people's ability to swallow, speak, and breathe, and can even become fatal. There had already been 3 medications on the market to treat the condition, helping protect the cells being attacked by the toxins ALS creates. But this week, the FDA approved a new medication called Qalsody that acts more offensively in cases where ALS is genetic.
The medicine that has been approved is for a very subset of this genetic form of ALS. It silences that gene so that it does not produce the toxic protein, and potentially it could be a game changer for these small subset of patients.
Dr. Raina says in studies, the drug slowed the progression of ALS symptoms in patients, but did not stop them. The hope is that the medication can prevent the disease entirely for people who have the gene but are pre-symptomatic.
Once you have identified a family with this gene disorder and you screen the other family members and identify other family members who who have the gene and it's still not manifesting the disease, that would be the very potentially optimal candidate for this drug.
So now that there's a medication for this genetic abnormality, Dr. Raina tells me that this completely changes the screening procedures for he and his colleagues, meaning that they'll now be running far more genetic testing to see who has it and who might be a good candidate for this treatment. Ken.